Hello, Assalamu alaikum rahmatullahi wa barakatuh. Welcome back to my channel. This is Dr. Sana. Today we are going to discuss about the topic pain during sex in females or painful sex in women. Why women experiences pain during sex. Pain during sex is often called as a dyspareunia. Is more common than the people realize. It has many causes like a physical, emotional, and hormonal factors. It's often mixed with several factors. Let's look into the reasons or the causes of painful sex or for the female. Why the sex is painful in some female. One is lack of arousal or lubrication. When a woman is not fully ready or fully aroused, natural lubrication is very low. The friction during penetration causes pain or burning sensation. The common causes are the common causes for the lack of arousal or lubrication are stress, rushing to the intercourse, lack of emotional connection. Now let's look into the next reason, the hormonal changes. Low estrogen level can make vaginal tissue thin and dry. It happens during some stages in female life, like a postpartum period, breastfeeding time, and menopausal time. The low estrogen levels in their body leads to the dryness in vagina, leads to the vaginal dryness and sensitivity. Now the third cause or the third condition, vaginismus, is vaginismus or muscle tightening. In vaginismus, vaginal muscles tighten automatically. It makes penetration painful or even impossible. It usually linked into fear, anxiety, or past trauma, the negative beliefs about sex, etc. During my college days, I heard one of the cases, one case of vaginismus. That was a young couple. The woman has the vaginismus whenever they try to do physical intimacy. She can't bear the pain. She has a severe pain during sex, and they can't even do the penetration. So they came to the clinic for infertility treatment. What to do to get pregnant? They had undergone a lot of sessions, and the clinical case was identified as vaginismus, and there was a lot of talking going on with the couple, and still the doctors couldn't help them, and the man chose to stand along with that girl. And while discussing the options, what he did is he chose for artificial insemination. What they did is the procedure they did is the doctors collected her sperm and injected to her womb or her uterus through artificial means. Alhamdulillah, she didn't have any other problems. She got pregnant and they had a baby. They had a baby girl, I think. We could see a wide variety of couples or wide variety of people in our medical experiences. So let's come back to our topic now. Now that's the next point, infections or medical conditions. Pain come from underlying health issues like yeast infection, urinary tract infections, sexually transmitted infections, conditions like endometriosis. The endometriosis can cause deep internal pain. Now, next point is lack of foreplay or rushing. The body needs time. In my previous video, I I clearly mentioned that male and female body is very different, and male only needs about half an hour for all the processes, and but the female needs 1.5 to 2 hours just for arousal. So men should adjust with the timings of the partner and to make her enjoy the sexual relationship. The female body needs time to become physically ready. Without enough stimulation, lubrication is insufficient, muscles are not relaxed. This makes penetration uncomfortable and painful. Now, next point is psychological factors. The mind plays a big role in physical comfort of women. Fear or anxiety about sex, past negative experiences, relationship problems, conditions like a depression, these can reduce the arousal and increase the muscle tension. Now, next point is injury or childbirth effects. Tears, scars, or healing tissue after delivery, or pelvic floor weakness or tightness, etc., can cause the pain. Pain may persist if healing is incomplete. Okay. Now, the next point is pelvic floor dysfunction. Muscles in the pelvic area may be too tight or not coordinated. This leads to the pain during penetration or deep thrusting. Now, the next point is allergic reactions or irritations, sensitivity to condoms or the latex allergy, sensitivity to the lubricants or using of soaps causes burning sensation, itching, or irritation. Important points: pain during sex is not normal to ignore. It is body signal that something needs attention. Physical, emotional, or both factors needs attention. Now, when to seek help? Pain happens frequently or consistently. Penetration is difficult or impossible. There is a burning or bleeding or deep pelvic pain, then you should seek a doctor's attention immediately. Okay. Now, let's look to the point what can help. Take more time for arousal or comfort. Open the communication with a partner. Use lubrication if needed. Address stress or emotional concerns. Or seek for medical evaluation if pain continues. So that's the end of today's topic. Let's stop over here. We will come back with another topic in the next video. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.